A large-scale multi-round finding by the National Family Health Survey revealed that obesity is leading to increased cases of hypertension and diabetes amidst the pandemic. Today, we have with us Dr. Sanjay Mittal, Director for Clinical and Preventive Cardiology at Medanta, to help us understand how diabetes put us at risk. Dr. Mittal, the National Family Health Survey states that there is a steep rise in obesity among the urban population. Please share your thoughts on that.
So that is true. It's been the trend over the last decade or so that the rate of obesity and other lifestyle diseases creeping up slowly and slowly. And I think there is a lot of things which has gone wrong over the last 2 years because of the lockdown and social distancing and work from home culture, that people actually have gotten majorly more worsenedly impacted by the restrictions. People have had, in any case, by Indian mentality, there was more than 60-70% of people who would have been not exercising or not having a leisurely activity, but now they have an excuse, which has been a kind of a directive from the government in the pretext of prevention of COVID. So the exercise has gone down, and that could have been contributing to obesity to a large extent. Moreover, I would believe that once you are home, you are having all the resources available for you to have indulgence into the home junk food. I think those two things are happening hugely, and these are leading to increase in obesity, and we are finding that too.
Also, doctor, with obesity comes risk of lifestyle disorders like diabetes, hypertension. Have you been seeing more cases lately?
Yes. So I would, Kalpana, here be very clear that two things have simultaneously been happening. One is, yes, obesity is going on, the exercises are down, the dietary indulgence is there, but we have to also understand the stress levels are going up because of the financial uncertainties, the job insecurities, the social distancing. The biggest thing which is a dissipator of stress is indulging into friendship and communication, interpersonal relationships. All those things have actually gone down. And on top of that, there is a constant threat of health scare. Now that Omicron is there, earlier on, Delta was there. No clarity is there as what's going to happen to you tomorrow. So the stress levels are creeping up constantly, and I think the biggest thing is that there's no certainty of the future also, that how soon is going to this thing release itself. So I think all those things compounded together is increasing the incidence of heart diseases, the diabetes and the hypertension. There's a surgence of hypertension, no doubt about it. I think recently when I analyzed my own data, those who have presented to me, there was about 45% people who actually presented with increased pressures, hypertension. So that's a remarkable increase. It's not just the lifestyle, it's basically also the whole gamut of things happening around us.
So doctor, tell us that are there any telltale signs that people can watch out for?
Yeah, so I have two parts of the answer to this. One is, the unfortunate thing is the hypertension as well as diabetes as well as cholesterol, they don't have signs and symptoms. Most of the times they are silent. Majority of the times when people say that they are stressed, they are anxious, their pulse rate is high or palpitation is there, it may not be a sign of hypertension, it may be the cause of hypertension, because if you are stressed, your hormones, the stress hormones are releasing, so it would lead to an increase in pulse rate and blood pressure. So that is not the sign of hypertension, rather that is the result of those stresses that the blood pressure is going up. The second thing is that if you have to understand that all these 3, 4, 5 things which we call as lifestyle diseases, be it obesity, be it hypertension, be it diabetes or impaired glucose tolerance, be it heart disease, all of them have common seeds, common soil. That means you have to be indulging into unnecessary diet, you are going away from or shirking exercise, being leisurely, and you have a lot of stress, and sometimes the genes, which we have, unfortunately, the Indian genes, which promote us to be diabetic or hypertensive or heart disease for unfortunate matters. So all those 3-4 things actually have common soil for all these lifestyle effects, be it diabetes, hypertension, or heart disease, or these things. So if we correct these 4 things, we are very likely to actually limit the chances of all these 4 things. That means hypertension, diabetes, hyperlipidemia, and heart disease to a large extent.
And doctor, when it comes to preventive therapy, what is it that we all know we should exercise every day. We all know we should eat healthy, and also, we should be ready with our ways to fight stress. But if you really had to give those, nuggets of information to people, that what is it that you can do to gradually work on it and lead a healthy life?
Well, not complicating the understanding of people, commonly I have those 5-point program.
Okay.
The first and foremost is exercise. That means I would say that we have to find excuses to exercise rather than most of us who find excuses to rest and go away from exercise.
Yeah.
So any exercise is better than no exercise, but the yardstick is about 10,000 steps a day, which is the cumulative activity through the day. It's not one-time activity, cumulative activity. And they say there are other yardsticks also, 150 minutes of moderate level of exercise per week, or 75 minutes of strenuous exercise a week. So any kind of a thing, but exercise is better than no exercise, and we should find excuses. Second thing is diet is fuel, just like fuel to your car. So your diet should be as much as you can burn. You cannot expect that you have parked the car into a garage and you are refueling the tank every now and then. So your refueling or the diet should be in proportion to your exercise capacity or your burnout capacity. If you are exercising daily like a laborer, or maybe like Michael Phelps, who is exercising the whole day long, you can afford to have 12,000 calories a day. But if you are just like me, a desk worker, a common routine worker, about 1,500, 1,600 calories are good enough. Anything more than that is going to be accumulated somewhere or the other by the body as fat. So that is a cumulative thing which would happen. So restrict your diet intake and calorie intake as much as possible in accordance to your diet, exercise. The third thing is there is no legitimacy of tobacco in any way form. Whether it is smoked tobacco or chewed tobacco, that should go. There is no logic of allowing it by anybody, because it can only produce wrong things, not the right things. So there's no negative thought about it. It has to go. The fourth thing is that you should actually do a regular evaluation for yourself. As I said, that diabetes, hypertension, and cholesterol, they are silent. They don't cause symptoms. Until you get themselves checked up, you would not come to know that your blood pressure is high, or you are developing an impaired glucose tolerance or diabetes, or you are having actually high cholesterol. So you should get periodically checked, especially in Indian population, because of high risk. Beyond 35 years in men and beyond 45 years in women, they should actually get themselves worked up. Specifically, if they have genes, that means a family history of young people developing diabetes, hypertension, or heart disease. And finally, the fifth thing, which is important for us all to understand, is stress. So how to learn to live with your life is important. And that is what we have, art of life, part of life, whatever you can call it. I would say a little bit of meditation and yoga does help you, but it is realization that you can be more effective, more productive if you have a controlled stress environment. Zero stress is bad and extreme stress is bad. I would say if you are losing your sleep over a particular point of time, you are overstressed. So have a proper sleep of 6 to 8 hours a day, and learn to do a little bit of yoga and meditation, and enjoy what you are doing. Realize that even if you have bad times, they are temporary. It's going to be at some point in time go away. So those are a few things which are important for me to explain to the audience, that by observing these 5 things, probably you can reduce the chances of having a lifestyle disease down the line.
Mhm.
Most of us would.
Also, doctor, another question that often bothers me is, I've seen people who eat well, who work out, but are overweight. So can you be overweight and healthy, fit as in?
That is true. There are people who have a low metabolic rate. That means
Mhm.
even if they have a small amount of calories, they will produce good activity by exercising and all, but still accumulate fat because that is in their genes. That is somehow how their metabolism is trained to do. So I would say any calories which is leading to increase in weight has to be controlled. They have to exercise extra, that much extra to burn that extra bit of their calories so that the fat gain is not there. And I would say that obesity, whether they are fit obese or unfit obese, they are not able to exercise. And fit obese,
Right.
just like you said, they have a good effort tolerance. They have increased risk of coronary events, heart events. So if I say you are fit obese, you would have probably 3 times higher risk. And if you have unfit obesity, that reaches to about 6 to 7 times higher risk. So you better be fit obese rather than unfit obese, but better not be obese at all.
Yes, yes. Thank you so much, Dr. Mittal. Thank you for joining us.
Yeah, thank you. Thank you. Thank you very much.